Hey everyone, it's Dr. Hodges, and I'm doing telemedicine today. And I want to make a little quick video between patients. You know, on a lot of my telemedicine days, I find that I'm doing a lot of medical weight loss. And here recently, I'm seeing time and time again a lot of the same issues that are popping up, and I wanted to kind of address that. I think the biggest thing for folks to know, especially if you're not a surgical patient, or let's say you had surgery and now you're doing some medicine to lose weight. Number one, if you're taking medicine to suppress your appetite, you need to know that it is not a magic bullet. It is not, there's nothing magical about it. Whether you're doing a pill or an injection. Number two, you need to know that as you increase the dose, your body is going to develop tolerance to the appetite suppression. Our bodies are very, very smart. And so if you find that you're beginning to plateau out, that just really means that you're not in a calorie deficit. And it doesn't matter if you have 30 pounds to lose or 130 pounds to lose, your calorie deficit is key. And if you don't have the benefit of surgery, then it is really going to be incumbent upon you to make sure that you are being very strict with the foods and the drinks that you're taking in and your snacks. And if you're able to do any exercise, you may not be able to do exercise. You may have bad hips or bad knees. And so you really have to rely on your diet. And in the past, I was part of the Obesity Medical Association, and this past year I let my association lapse, but I'm going to re-up that OMA, and I had gone to one of their classes, and I thought it was really interesting. One of the things that they noted was that when you're trying to lose weight, diet is one of the key things that you have to take into account for you to be successful. And then once you lose the weight, exercise is key. And that makes sense because it is much easier for people to get into a calorie deficit by changing their caloric intake as opposed to trying to burn off that same amount of calories. Most people will really overestimate how much they burn because they use their Apple Watch. And I'm like, that Apple Watch, you did not burn 800 calories. If you did, you wouldn't be seeing me. Trust me. And that's regardless of your size. Just keep that in mind too. And people really underestimate how much they eat. And so you really need to put in the work. If you are going somewhere and you're just getting an injection like online, there's nothing wrong with that. The reality is that you will be part of one of the statistics. And the statistics show that only about 2% of patients have long-term success with purely medical weight loss. That's what the statistics show. And what the statistics also now show is that the weight loss that patients get from an injectable, that's in a clinical research setting. When I'm looking at people out in the real world, so people that maybe they don't have the benefit of talking with a nutritionist, or they're not constantly talking with a doctor, or they don't have a health coach, or all they're doing is they're taking a medicine to lose weight. You're probably only going to, that medicine and your long-term success, like when you look at the average amount of weight loss, it's probably going to be half of that. And it's because all the medicines do is suppress your appetite. They do not control behavior. And so if you're doing a medical weight loss program, you need to calculate your BMR. And I will have a link below. It's on my website where you can calculate your basal metabolic rate. You need to get your basal metabolic rate. That is the calculator that I use. It's based on the Mifflin St. Jour. It's a very, very great way. It's a non-invasive way to calculate your metabolic rate. So that's number one. Number two, you then need to take whatever that number is that you calculate and subtract 500. And that's what your caloric intake needs to be for the day. If that number that you calculate is going to be below 1,000, then that means you need to keep your calories at 1,000 and you need to supplement that extra deficit with exercise. So for instance, for me, my metabolic rate is 1,087. I have to keep my calories at 1,000. And then if I want a deeper deficit, I walk. I don't do strength training. I need to, and I say this all the time, but I just walk. And every mile you walk is 100 calories burned. So when I was at the peak of trying to lose weight, I was taking medicine. I was taking a pill. I wasn't even doing the injections, but it took me about a year and a half to lose about 45 pounds, 45, maybe 50 pounds. And I was walking 3 to 5 miles a day, 4 to 5 times a week. So, because that was the only way, and keeping my calories at 1,000, that was the only way for me to get a good deep deficit. And so, what this all means is if you're doing a medical weight loss program, you have to put in the work. It is not taking an injection and just like, oh, I'm going to lose weight. And there's also some false thinking that, oh, if I take the injection, I just need to get a higher dose, so I'll lose weight. The medicines, the injections, the oral medications, they do not affect your metabolic rate. All they do is suppress your appetite so that you can then do the things you need to do so you can stay in a calorie deficit. And everybody, depending on their genetics, depending on their weight, that you then need to know what your metabolic rate is so you can kind of get below that so you can have good long-term success. So that's just a little insight that I'm seeing time and time again as I'm doing some of these medical weight loss, where patients are like, I've been on the medicine and I'm taking it like I should, and I'm just not losing weight. Well, are you taking the medicine and is your appetite suppressed? Okay, that's number one, because if it's not suppressed, then you either need to increase the dose or you need to have some combination of the medicines to get good appetite suppression. So that's number one. And then number two, are you logging your calories and are you staying in a calorie deficit? And number three, if you're able, are you able to even do a little bit of exercise? Even if you can do a sit and be fit. I need to make some videos on that for my patients that maybe they have bad knees or bad hips. There's still some things that you can do with your upper body to try to get in a little bit of calorie burn. So some key points. It is losing weight is not easy. There's no magic bullet. And, if you have surgery, for my patients that are out there, you also know that that's not easy either. It forces you to make some big lifestyle changes. And speaking of, that's one thing that I've also seen with medicine. Let's say patients are taking the shot. Well, if they have a big holiday coming up or a big vacation coming up, they just don't take the medicine so they can enjoy their cruise. Well, you might be able to eat more because maybe now your appetite isn't suppressed, but just make sure that you don't undo all the good work that you've done if you're trying to lose a significant amount of weight. So just some food for thought, and put in the work. It will be worth it. You're absolutely worth it. So it'll do your body good.